quadriceps muscle group vastus medialis,
It's right here.
vastus lateralis,
Here.
VMO,
Right here.
rectus femoris, sartorius,
Comes across
quadriceps tendon,
above the knee.
patella,
Right here.
patellar tendon,
Down here.
tibial tuberosity, lateral meniscus and joint line, fibular head, lateral collateral ligament, popliteus tendon, biceps femoris tendon, IT band, Gertie's tubercle, medial meniscus and joint line, medial femoral condyle, medial tibial plateau, medial collateral ligament, pes anserine tendon and bursa,
The tendon is right here, and then the bursa is just on top of it.
semitendinosus tendon, gracilis muscle, hamstring muscle group, biceps femoris,
That one's like right here.
semimembranosus,
Right here.
semitendinosus,
And just goes on top of it.
popliteal fossa,
Right here.
heads of the gastrocnemius muscle,
Origin and then insertion.
and that is all for palpations.
Next we do active range of motion of the knee. So I would have her first just flex and extend it. And then I have her do it again with the. So she is at about 136 or 7, so that's in the normal range from 135 to 145. And then have you extend again. She's at about -3 or 4, which is in the normal range of 0 to -10. And then we'll do passive range of motion. So for this one, I'll have her lift it up. And I'll just extend, flex, and you'd compare bilaterally on all of these. And then next we'll do manual muscle testing. So I'll have you bring your leg to the end of the table. Stabilize here so they can't use their upper leg. Then I'll have you push against my hand for extension. And then I'll have you flip over. And then for flexion, I'll have you like this and stabilize here and then push against me. And then you'd compare bilaterally again to test the strength. And then you can flip back over. Oh wait, just kidding, go back. That's for normal. And then you can also have them externally rotate and do it again. So push against. And then internally rotate. And then push against my hand. And that to external rotation is to test like semitendinosus and membranosus, and then internal rotation tests the biceps femoris. And then next we'll go into special tests. So first one would be I'll start with sweep test. So you have them lay on the table, and then you just put your hands here and you just squeeze together above and below the patella, and this tests for excessive swelling in the knee. And then you would do, I'll do the patella test. You just put 2 fingers here and you push down. This one tests for excessive fluid in the joint. And then next, I'll do Noble's compression test. So I'll have you lift your leg, and I'll put my hand here with my thumb on the IT band, and then internally rotate, and then I'll just flex and extend with my finger or my thumb over the IT band, and this one would test for IT band friction syndrome. And then next I'll do Godfrey's 90-90 test. So I'll be bringing your leg back up. For this one, you would just hold it here, and you would look for sagging in this area compared bilaterally to the other leg. And if there's excessive sagging, there's a sprain or tear to the PCL. And then next I would do posterior drawer test. So I'll be flex your knee, and then I'll sit on it to stabilize it. And then I'll put my hands right here. And then for posterior, I'll push in. And then testing bilaterally if there's an increased amount of like posterior movement, that's indicative of a sprain or tear to the PCL. And then next for anterior drawer test, so the same thing, but this time I'll pull forward. And if there's excessive anterior movement, then that's indication of a sprain or tear to the ACL. And then next I'll do Lockman's test. So for this one, put my knee on the table and have her go like this, and I'll hold here to stabilize, and then the other hand I'll put underneath like this, and then hold here and pull forward. And then increased movement anteriorly again will also indicate a sprain or tear of the ACL. And then next I'll do valgus. For this one, I'll have you extend your leg, and then internally rotate the foot, and then I'll apply stress laterally, and then pain or increased medial movement indicates a sprain or tear to the MCL. And then next I'll do varus testing. So I'll rotate the foot and apply stress to the medial side. And pain or excessive lateral movement is indication of a sprain or tear to the LCL. And then next I'll do the lateral pivot shift maneuver. So for this one, I'm gonna extend the hip, or flex the hip, and then I'm gonna grasp her ankle, internally rotate the tibia, and then apply varus force. And then if there's pain or like clunking, that's indicative of damage to the ACL and LCL, which would cause anterolateral rotary instability. And then I'll do Slocum drawer test. First I'll do internal rotation, and then I'll sit on it, and then I'll do pull anteriorly, and then if there's increased movement forward or pain, that indicates damage to the ACL and LCL, which could cause anterolateral rotary instability as well. And then next I'll do external rotation, and then sit on our foot again, and then pull forward. And then with this one, if there's pain or excessive movement, it would be damage to the ACL and MCL, which would cause anteromedial rotary instability. And then next I'll do the Houston's drawer test. First I'll do the medial one. So then I'll go back to, medial would be external rotation. Then I'll sit on it again, and this time I'll push in, and then excessive movement in indicates posteromedial instability, which is caused by damage to the PCL, MCL. And then for Houston's lateral drawer test, I'll rotate her foot in, and then I'll sit on it again, and then push in, and then increased movement is damage to the PCL and LCL, which would cause posterolateral rotary instability. Next I'll do McMurray's test. I'll hold her foot and support here. For this one, you rotate the knee in as you also rotate the foot. And then if there's pain anywhere within the knee, that's indicative of a meniscal tear to like where the pain was located. Next I'll do Thessaly's test. So if you want to come over here and stand, I'll hold it. You could have them hold onto the table or your hands for stability. Stand on the affected leg, and then just a little bit of bend in the knee and rotate in and out. If there's pain or they're not really able to do it bilaterally, that indicates a meniscal tear as well. Next I'll do Apley's compression and distraction test. So I'll have you flip over. And then for this one, you go here, rotate it, and then you apply pressure for compression, and then you can pull up for distraction. And if there's pain with that or excessive movement, then that's indicative of a meniscal tear as well. And then now I'll do dermatomes and myotomes. So for L1, you start up here and you come straight across to the groin. And then for that one, for the myotome, you do hip flexion on their own. L2 is up here. And you'd come across to like mid-thigh. For that one is also hip flexion. L3, you do hip to like down here in the gastroc, and then the myotome would be knee flexion. For L4, you start lateral thigh and go across the patella to the big toe, and that one would be ankle dorsiflexion. L5, you'd start lateral thigh, come across here and go in between the toes, and the myotome would be great toe extension. S1, you'd start here and go across to the big toe, and this one would be ankle plantar flexion. And then S2, you start up here and then come down to the heel, and the myotome would be knee flexion. And then for L1, there's no reflex test. And then L2 through L5, I would do patellar tendon reflex. So I'd come over and then tap here. And then S1 and S2 would be Achilles tendon reflex.